Debbie Sabatini, thanks so much for being with us.
Pleasure. Thank you very much.
Now, Debbie is a dental hygienist, so we've talked with the owner before. Now we're going to talk with and she's out of Hope Sound, Florida. Love that area, West Palm. But Debbie.
Yes.
Okay, so from a practical standpoint, in your office now, how are you using, and by the way, you are the gatekeeper, can you see this? Of your patient's total body health and well-being, so get with OralDNA. Okay, now, tell us about your office. We've got 3 tests here.
Yes.
Tell me about the 3 tests again.
Okay. We have one called the MyPeriopath that indicates a patient's bacterial level. And those bacteria that are related to heart disease, that are related to periodontal disease, tooth loss, bleeding gums, bad breath, but also how it correlates to the oral systemic link, whether it be heart disease, diabetes, stroke, and it's a great indication or a great portal for a dentist to work with the physician about a patient's overall health.
Okay, and the second test is?
We have a genetic test because periodontal disease also has a genetic component.
Right.
So we're able to indicate by a simple salivary test whether a patient is predisposed by genetics.
Okay, and then the third test is?
The third test, which we've been very busy with, is our oral HPV test. And we know oral HPV, the virus, also causes oral cancer.
Right, oral cancer. So, okay, so those are our 3 tests. Now, let's talk about the practicality. When would I use let's talk about the 2 perio tests here. Okay, we're going to go that first.
Okay.
When would I use the 2 perio tests?
Well, in most of my offices, they use it as part of their patient overall comprehensive exam.
Okay.
So they're getting a complete profile of what their patient is presenting with the day they walk in their office. It's like getting a baseline periodontal charting or an x-ray.
Okay. Or maybe, you know what? You get a cholesterol test. You you hope it's not positive, right? And if it's not positive, they don't say, oh, well, I shouldn't have paid for it.
Right.
Right. I mean, you're looking to diagnose here and find out if there could be a problem.
Well, you're being a little bit more proactive to be preventive. So if we find something, you know, we're able to treat it conservatively instead of it being a surprise to a patient.
Okay, so your cholesterol is a little high. Well, you're okay.
So you modify, right.
Here we go. Okay, so in initial diagnosis, it's advisable to use these tests on all patients, both the genetic predisposition and the
periodontal pathogen
test.
Yep, and it's a great thing, especially for patients that are contemplating implants, because we're able to predict their outcome, and if there's anything that needs to be done prior to placement of implants, it's a simple procedure. So a lot of the physicians are using it prior to implants and prior to full mouth rehab and things like that.
She says a simple procedure because, as you find out in the other videos, they tell you what to do to treat it if there is a problem.
Exactly.
Exactly what to do with the medication or whatever that you need.
If there's
so it's not just the test, they tell you what to do to treat it.
Correct.
Okay. So what about the recall patients? Would you ever use this for a recall patient?
Yes, because if a patient, well, I mean, you can have a periodontal disease is episodic, so a patient could be maintaining health and then come in for a recare visit and show indications of bleeding, or they're noticing some sensitivity or some pain.
Right.
So if you want to find out if it's bacterial related, it's a simple 30-second swish. Get the pathology report back, and you're able to indicate or cross off whether it's bacterial related. And also if a patient's health history has changed. You know, maybe they were undiagnosed diabetes and they've been struggling with certain issues, or you're noticing, you know, their blood sugars have fallen, or, you know, symptoms like that. It's a great indication or a portal to open up to the medical community.
Or maybe if they're going in for surgery for some reason.
Pre-op, perfect pre-op. I mean, when a patient gets intubated and they have an active bacteria in your mouth, you know, the tube goes, like I say in my office, over the river through the woods, you know, into the lungs. And, you know, there's certain bacteria that are... Right, so there's certain bacteria that are correlated to respiratory ailments. So
show us how easy one of these tests is now. So the perio test, the 2 perio tests, they have a red cap.
Correct.
Okay.
So what we would do...
The cancer one has a green cap. We're going to get to that in a minute.
Would you like to do it?
Yeah, let's do it. Okay.
So if you were my patient, this is the actual test. Okay. We have a barcode that would have the patient's name and date of birth.
Okay.
And what we would have you do is empty the contents of this test tube in a sterile saline solution. Okay. So you can empty the contents in your mouth.
Okay.
And once that's emptied, we would have you gargle and swish for 30 seconds, and then empty the contents into the test tube. Go ahead. You're good.
Well, that was fun.
Right.
Okay.
And then you would
no
just
big deal.
no, you
Didn't
just
taste anything.
No.
A little salty, maybe.
A little salty.
Not bad at all.
And then place the cap back on the test tube with the patient's information,
Okay.
and the collection bag would be right here.
Okay.
And FedEx would pick this up, overnight it to our lab, and then we would start the processing.
Boy, that was easy. Let me do another one.
Very easy.
Okay.
And then the HPV test would be done the same way.
Okay.
And it's again another 30-second rinse with the saline solution.
Yeah.
And then we would send it off to our lab. Within 8 to 10 days, you would get the results back via a HIPAA-compliant internet portal. So you're not worrying about papers and reports getting lost in your office.
So this is simple. It's important. This is huge. Is there anything else you'd like to tell us before we
this
close
whole
here?
well, salivary diagnostics is really taking dentistry to a new level. It's already increased. It's increased our standard of care in what we're doing for our patients. But it's really bridging the gap between the oral and the systemic and the medical community, which is it's a phenomenal place to be, in our profession. So I really think that we're here to stay, and we invite everybody to join us and help us in what we're trying to do.
How would we possibly get a hold of OralDNA Labs? Do you have a website?
We have a wonderful website. It's www.oraldna.com.
Okay. Deborah, thank you so much for
My
being with us.
pleasure. Thank you. I appreciate it.
Okay.